My name is McKee, and I am a neuropathologist at the Boston VA healthcare system. I first came to realize that trauma can have a terrible effect on the brain back in 2003. And that's because I look at the brains of people after they die. To date, we've looked at the brains of 63 deceased former NFL players, and we found this disease called chronic traumatic encephalopathy in 60 of them. And we started seeing this really horrific disease in the brains of football players and now athletes of many different sports, soccer players, rugby players, baseball players. And we need to understand how a concussion or a series of concussions, or maybe even what we call subconcussions, how do these injuries lead to this terrible neurodegenerative disease? If your child has a head injury, or even if you suspect in any minor sort of way that your child has had a head injury, you want to pull them out from what they're doing and evaluate them. Have them seen by someone who knows what they're doing, who understands concussion and how to evaluate a child for concussion. And then not allow them to return to play until they're recovered, and that's fully recovered. What we think is very dangerous for our kids is when they re-injure themselves on top of an unrecovered injury. My advice is pretty simple to any parent who has a kid playing sports. Let them play sports. There's exercise, sports, fantastic. Really no substitute for the benefits even to your brain. But play smart. And that means keeping your head out of these games, making sure that that everyone is aware that head injuries can have risks. And so if a head injury occurs, identifying it and removing the kid from play, and then playing smart, taking your head out of the game, not tackling or using your head as a weapon. You can play many of these games with different techniques that really minimize the amount of head contact.